Hi students, hope you all are doing well. So, welcome to another very exciting session of healthcare entrepreneurship. So, we are going to pick it up from where we left last time. So, let us get started. Over the last decade, India has reduced communicable diseases, which is a great reform. Maternal, neonatal and nutritional related deaths have drastically decreased. So, if we look at the plot on the right, so we can see the communicable diseases, neonatal and nutritional diseases have kind of converged. So, from a very broad on the left side, on the right side we are looking at the curve kind of converging, which basically indicates a decrease. There has been proportionally a rapid increase in non-communicable disease. So, communicable, as we all know, communicable is like something like COVID, which can be transferred from one person to another. Non-communicable diseases are like lifestyle diseases like cancers, diabetes, which cannot transmit from one person to another. So, the burden of these diseases due to the lifestyle, climate change, air and water pollution has drastically increased, and just look at the blue region here, how much this is increasing rapidly, right. There is another form of which is considered to be a disease burden is through injuries. They could be from a burn injury or some orthopedic injury, and from a fall, slip and so many things. So, the injury burden is almost constant with a slight increase. The increase is specifically because of lot of vehicles and so many things we are doing out of hurry, and there is a slight increase, but it is not very significant. What is significant as and the key concern which we should all think as an entrepreneur is the non-communicable diseases such as cancers, diabetes, hypertension. These kind of diseases are the key focus for this generation. Cardiovascular diseases remains the top cause of mortality worldwide, and that is similarly observed in India as well. So, cardiovascular diseases are anything which relates to your heart. So, basically culminates in the form of a heart attack or some kind of a requirement for heart surgery, or there is a plaque or a clot in the certain arteries. So, cardiovascular diseases, vascular is through vessel and cardio is concerning with the human heart. So, cardiovascular diseases are the biggest burden creators in this generation. Increasing burden of diabetes, cancer and kidney diseases. So, as I have already mentioned, India is almost going to be the diabetes capital of the world by 2025. It is a very clear projection, and it could be due to non-reporting, it already is the diabetes capital. So, every third person you are looking at of the age of 40 and above usually has some or the other form of diabetes, right. Cancers are quite skyrocketing, kidney diseases are also coming into place. Mental disorder is a new addition which has come in specifically, it had been around like for a while, and in several highly developed countries like US and Europe, it was already recognized 15 or 20 years back, but we are slowly coming into the realization or recognition of mental disorders as genuine problems. Earlier we used to think of mental disorders as something which is very normal, or somebody is just having a bad day or a bad time, but mental disorders are currently very importantly recognized by the government of India also. These are typically underreported, and often treatment is never sought in a formal setting, but still contribute to a huge fraction of the overall non-communicable disease or the NCD burden, right. So, mental disorders can lead to a suicide, it can lead to so many other forms of depression which causes several other issues, like there could be incidence of diabetes and other lifestyle issues due to mental disorders as the primary factor. So, mental disorders quite often underreported because nobody wants to still talk about mental disorders in a very formal setting, but because they because of their own inhibitions, and they would think typically that somebody would think that you are crazy, or you are not really a sane person. So, sometimes we would refrain from discussing our mental disorder issues, but Post pandemic, people are recognizing this more and more due to the lockdown, and after this, like, people are seeing a lot of mental issues, like out of depression, or somebody has lost somebody in their life, or lost a job. There are so many stresses and other stressors which are adding to the mental disorders. Disease burden on the rise in the typically 15 to 49 age group. So there is a huge increase. So you're looking at the plot on the right, which is age group wise disease burden. So you're looking at the 70 plus years old, there is a slight increase. 50 to 69 years old, quite an increase. So all these graphs are typically increasing. 5 to 14 years old, most of the increase is not there. So it's kind of stable. 5 to 14 years old, that means most of the public health programs and like other aspects are kind of taken care for the adolescent population, like 5 to 14 years old. So 14 is not exactly the adolescent, it's pre-adolescent, but this is the journey of a kid, like, which goes from 5 to 14 years. Under 5 years, also the majority of the disease burden has reduced drastically, which is very good to see. But 15 to 49 years is a key area which is of concern, where a lot of this lifestyle diseases and chronic diseases are kicking in. 50 to 69 years, again they are kicking in, but not with a significant or drastic increase as we would think for the 15 to 49 years old. And 70 plus years, again the disease burden is increasing, but not at this rate, right? So these chronic disease management with likely further stress the health care's ecosystem as the demographic ages. So as we are heading towards the more aging population, of course people are aging up. So when they go from the 5 to 14 to 15 to 49 years old and so forth, this is going to create an additional burden to the healthcare system, which we are currently looking at. It already is so overburdened, and it is going to create a further overburden on the healthcare system. Further, there is another category which I was just talking about is injuries. So what are the disease burden from the injuries? So if you look at the plot on the right, traumatic injuries, traumatic means something which causes a trauma or a really bad effect on the body in terms of breaking of a particular part, or a tearing of muscle, or it creates a long term trauma which you are not able to recover from that injury. So those are traumatic injuries, typically caused due to road accidents, are steadily on a rise and likely to grow with increasing population. As the population is growing more and more, we are buying more vehicles, and there is so much transport on the road. So and there is so much stressor, we have to go from here to there at a much more quicker pace. So the road accidents are on a significant rise across the traumatic injury category. Preventable falls also on the rise and account for 20% of injury related disease burden. So preventable falls, so there are several falls where we can prevent ourselves, like if we were not running around quite quickly, or if we would have noticed the steps in certain cases. So they also account for a huge disease burden, and quite a few of this to be noted are from the elderly population, where the sensory motor control, or how we actually carry our body forward, or it is sometimes known as the gait, how do we walk and run, typically that aspect changes, and the chances of falling also drastically increases. So typically in the elderly population, this is quite often observed, that there is an increase in the disease burden. Mental health and socio-economic pressures are also driving up suicides and self-harm related incidents, accounting for nearly 10 million incidences in India alone. That's quite a bit of number, right? 10 million. So, a million is 10 lakhs, and you are looking at 10 million, which is a crore. So, 1 crore of incidences in India alone, this is on a yearly basis, right? So, this is quite high, and something to be taken into account while you are trying to look into your entrepreneurial journey, that mental health could be something which you can also tap along with the other traumatic and chronic diseases. So, is what we are going through currently with the healthcare space, is it a catastrophe or a chaos, or is this an accelerated start to a new era? This is a very pertinent question to be asked, that whether things are going down the lane. Many of the people you will start talking about, they would say healthcare is going towards from good to the worst, people are going to suffer a lot, there are so many diseases. Is it going in that direction, or is it like so many new technologies are coming that it is going to solve some really good issues like which we are facing in the healthcare problems? So there is a differential and uneven impact across the healthcare system. If we look at specifically the pandemic and the diseases which are going around, the official figures suggest a large degree of resiliency to increasing stress. So as an Indian market, this is a very good knowledge or very good point to be noted, that our system has showing a lot of resilience or robustness towards the increasing stress burden of the disease. Even though we have so much stress burden, we are able to manage this pretty effectively so far. This is very good to know. SPAR and medical innovation. So this is where a lot of us entrepreneurs come in. There has been so much into the medical innovation from a vaccine and pharma innovation standpoint. So vaccines, for example, the COVID vaccines were built at a record pace. None of the vaccines ever in the world were kind of developed in such a short span. So this is a huge innovation, right? Medical devices, open source medical ventilators, oxygen concentrators, these are for some examples, were quickly built around the pandemic, and there are so many other devices which are right now manufactured at a huge pace. This includes diagnostic devices, implants, and so many other lifestyle based devices. Like for example, glucometers, very few component or few part of the population would ever buy a glucometer, or would ever buy a blood pressure measurement device or an oximeter, right? But that population has increased quite a bit. Now we have digital thermometers. That market was not existing. We would always use an analog thermometers, and digital thermometers were there, but not used so diversifically, or not everybody at home had a thermometer. Now in my home only I have like 6-7 thermometers of different capabilities and different brands, right? So there is this very quick and high manufacturing market which is going at a very high price. Democratization of health data, open source dashboards. So earlier, to understand quite a bit of diagnosis and what is written in your report, what is this medicine about, we wanted to kind of know it from a doctor, but these days from Google or so many websites, you can very quickly understand what does a medicine dosage mean, is this medicine the right medicine I should take, or what is this disease modality or this particular term is meaning. So, and also there are so many generic health data which is shared online, that if you look at a particular kind of rare ailment, like you have some kind of a hair loss or some kind of an issue on the skin or an allergy, you can look it up online and get so much of information and case studies, right? So things are quite changing with the generation. This is one of the good things which has happened. So there are so many multi-speciality hospitals where the pandemic has led to the decline on the number of OPD visits. So specifically we have seen during the pandemic, due to the communicable part of the or the spreadability aspect of the disease, like which is the COVID-19, there has been a reduced amount of hospital or the OPD visits, the outpatient visits, and in several cases this has shifted to telemedicine, which is very interesting. Varying impact on several specialties. So if you look at single specialty hospitals, so there are certain hospitals which are specifically dedicated to certain specialties. In those hospitals, the case volume in certain single specialty dealing with non-emergent cases have reduced. So for example, if certain hospitals are leading with cases of, let's say, hernia and some trauma surgeries, those cases may have reduced, and several of the specialty hospitals have booked losses and whatnot. So they had to be converted to a multi-speciality or had to be shifted. So if you are looking from a hospital administration standpoint, or you're interested in setting up a hospital or a clinic, this is something to be kept in mind. Diagnostic labs, infrastructure and other capabilities were ramped up rapidly, and increasing test capabilities. We all know how quickly the diagnostics or the COVID-19 tests were being conducted all across hospitals, all across labs, very similar with the blood sample and other collection. Things have rapidly skyrocketed. Like, these days if you need some diagnosis to be done, you call up let's say the Max Healthcare or somebody in Apollo, and they will, or the Lalpath labs, they will quickly come to your home, take your sample within the evening or something, you will get your results. This kind of a quick movement where everybody is trying to go for speed and the size of doing the healthcare diagnostic has never been seen before in this era. Medical technology. Innovations in medical devices and technology has seen a boost to support the new paradigm of care delivery. So, we are seeing a huge amount of medical technologies which are coming in, so many wearable devices which we are looking at from a day-to-day basis. Health tech. A number of hospitals and healthcare centers are increasingly adopting digital solutions to provide alternative models of care delivery like telemedicine, e-pharmacy. So, there has been so many apps which is for taking care of your medicine needs, whether you need a medicine top up, or you need to take a certain medicine at a certain time, certain vaccines, or there are telemedicine consulting, let's say out of 5 which you have paid for, 2 are free, something like that. So, there are so many packages, healthcare packages. So, a lot of this health tech revolution is going through, like kind of mostly post pandemic, where people are really interested to know what their blood counts are and so many other modalities. Health insurance penetration and insurance coverage have increased, but so has the risk of insurers, as insurance policies providing coverage against COVID-19 are yet to be well defined, and in certain cases several other critical diseases, exclusions, limits and risk categorized properly. So, healthcare insurances have skyrocketed. If we look at, like, let's say Policy Bazaar, which is kind of a service for shopping for so many healthcare insurances, or you're specifically going for, let's say ICICI Lombard, there is Max Life, there are so many healthcare insurance providers. You go for them, you will quickly, you can check out, put some prescriptions or details about yourself. But the problem is, this has increased quite a bit, that you can very easily get a healthcare insurance, but when you're trying to claim it, then the problem starts. You are not aware of what are the inclusions, what are the exclusions. So, the insurance providers which mostly try not to give you an insurance claim, or give you a partial insurance claim by putting certain things as which is non-traumatic or non-emergency or things like that. I am sure many of us would have faced this. If you had claimed some kind of a health insurance for yourself or your family or your parents, like we have to sit through the entire day to make sure there is a cashless claim, and certain things, there are so many objections. So, it frustrates a lot of customers which is happening. So, this healthcare insurance domain is another space in which a lot of innovations are needed. So, the post-COVID era has really redefined the healthcare delivery and the care setting. So, a renewed interest has been there in a digital health solution and personal health and wellness and fitness. So, many of us are looking into fitness apps, and this we can all relate into, and also looking at what we should eat. So, we are in so many apps like Healthify, and so there are so many plethora of places in which we have kind of registered ourselves, where we want to just know what should be the right food for my kid, what should be the right food for me, how much should I exercise, how many steps have I taken. So, typically the market size for telemedicine in India was around 830 million in 2019, and it is projected to be 5.5 billions by 2025, growing at a CAGR of 31%, massive increase. This is where the telemedicine technology is looking at. So, a lot of you folks can actually look at telemedicine, leveraging telemedicine technologies to build meaningful apps which can serve a lot of purpose, because it is quick to do, but it has to be a unique idea, because there are so many other competitors in the market. So, this is a great entrepreneurial opportunity. typically what we have seen is 85% of the clinicians are using teleconsultation and digital platforms during the lockdown. This is a very, very important finding to be noted. 85% of the clinicians are using telecommunication based systems. So, we know if we have some kind of a medical innovation which connects the doctors and the patients, this telemedicine technology can be tapped. 50% of doctors found digital platforms to be an effective tool for patient interactions. So, 50% of the doctors are very happy with interacting with the patients over the digital platform. They do not have to spend a lot of time in diagnosis or physically coming in contact with the patients. They can do it on their own time through teleconsulting and get paid pretty well, right. 80% teleconsultation services were from first time users. So, this is another very important fact to be taken as an entrepreneur if you are trying to get into the digital space, right. 80% were first time users. So, the first time users are not only curious, they are very excited to jump into the space. So, there can be so much of tapping into the teleconsulting services. 44% of the teleconsultations were from non-metro cities, another huge opportunity. We would usually think that most of these app based things are done by the city people, but that is not true. Majority of the 44% is a very good number. From the non-metro cities, people are looking into teleconsulting services, maybe because they do not have very good doctors around, or could be they want a diagnosis very quickly, or they want some kind of a response to their disease or something which they are facing at a very quick note. So, if we look at the plot at the bottom, we are looking at the virtual health as a percentage of outpatient and office visits. So, telehealth, behavior health only, and telehealth all specialities, quite a bit of good percentage. So, 70% of the people are actually willing to go for a virtual teleconsulting. So, that means doctors visits can be drastically decreased, right. So, with this we are going to talk about quite a different set of personas. So, what is a user persona? Let me define. So, user personas are some ways to basically define a very key profile for our customers. So, let us talk about a little bit into the different user personas which are there in the telehealth services domain, right, across the continuum of care. Continuum of care basically means which makes sure that a person goes through the different stages from diagnostic to treatment to follow ups of the care, right. So, this is the first user's persona where we are looking at an emerging risk, the phases diagnosis. So, typically this person Mary, this can be anybody who is a 50-year-old, has obesity and other risk factors potentially related to diabetes. As we all know that obesity is quite often indicates the possibility of diabetes, that is the case. So, she or he does not drive and has a husband and a son. The current state of affairs is she schedules routine visits, in-person wellness appointments with primary care physician, which is the PCP, or in any kind of primary care physician office. PCP or the physician offers urine sample and A1C test, blood test for which is the blood test for the glucose levels to screen for diabetes, right. So, this is at a diagnosis level. The potential future status, she could or she would schedule routine telehealth wellness appointment based on the diagnostic tests. Because of diabetes risk factors such as urine and A1C test shifts in advance to be sent back by mail. So, basically what that means is they test is conducted separately, and then finally by mail the reports come, and by email there is a report, and these are all shipped to a lab or a center like where the tests are conducted close by in the vicinity by mail or some kind of a service. So, then the physician basically discusses the results by telehealth visit. So, based on that, so so this is the kind of scheme of things which are going to happen to any person fitting this profile, having a possibility of diabetes around in the elderly age of 50, right. Let's look next. Next is a type of provider consultation where healthy or low risk population is looked at, and this could be very generic. So, you are looking at a 20-year-old who has no chronic conditions, who is not married and has no children, right. So, current status: wakes up with burning sensation during urination, goes to the urgent care center. Urgent care center is like any other health center, it is quite often known in the US. Picks up prescribed antibiotics at the pharmacy for UTI or urinary tract infection, and basically potential future status: connects with an on demand doctor through telehealth and drops off urine sample at urgent care clinic. So, basically has a teleconsulting, and based on that, doctor says that like you go ahead and submit your samples, gets diagnosed with a UTI and is prescribed antibiotics. This is how the process went, and antibiotics are ordered and delivered to home by the end of the day by the service provider. So, this is how the teleconsulting service is being provided to this particular kind of customers, right. So, care at the home interventions, if we look at medical or medicines delivered to home very quickly, that is on the bottom right, and telehealth urgent care visit. So, these are two important aspects which this set of customers or particular population specifically generalized by the name Lorry is looking at. Right. Oops. Next, so somebody is next fit to the population who is planning a procedure, right. It is a part of the ongoing management. So, this person is 50-year-old, has a kidney failure and has a wife and 2 children, right. So, the current status: has kidney failure and receives dialysis 3 times a week at a nearby clinic. So, that is the current state of affairs. The potential future status: Frank and his wife are trained on how to administer dialysis at home. So, they would like to have a home based care. They are able to administer dialysis at home with wife's support, that is a possibility, and sets up a remote patient monitoring to prevent adverse outcomes. So, they want to still be very that like they are not doing everything by their own. They want to be very clear that somebody is able to monitor their progress or whatever dialysis based medication is being advised. So, basically from the home intervention standpoint, you are looking at self administration of treatment. If this is being provided by some innovation through your particular service or product, this could be something of value. Remote patient monitoring. So, you are looking at all the keywords here which an entrepreneur should pick are the gap areas in which this particular set of customers can be addressed. And when we are talking about particular set of customers defined by Frank, we are looking at a huge number, right. Self administration, if that could be trained through some videos or in person training, and remote patient monitoring if that can be implemented. Okay. Next one is a phase of self care by high risk chronic conditions. So, these are all the states in which we are trying to define certain opportunities. So, at the very bottom right, you are looking at the possible entrepreneurial opportunities. So, this person is going through, or set of people are going through high risk chronic conditions, typically around 80 years old, has congestive heart failure, diabetes and depression. This person is divorced with no children. That basically means it lacks support. They do not have any family support, right. So, current status: he has difficulty remembering to take medications, make lifestyle changes and keeping appointments, as this would be necessary for recovering properly from the condition. No psychologist available nearby to treat his depression, as he does not have any family with him and he is coping up with this health problem. He is going through a state of depression. This is also a very common type. You could think of a lot of elderly population who could be part of your family or a extended family or other families, right. So, what is the future potential state of things which this person goes through? The primary care provider or the PCP assigns a care manager and sets up remote patient monitoring. So, a care manager is there who is setting up a remote patient monitoring. The care manager does not have to be with the patient all the time. They just introduce this remote monitoring tool with them and kind of connect with them from time to time whenever there is an emergency or they feel like something needs to be administered. Otherwise, there is a remote monitoring, right. So, PCP gives referral to the telebehavior health providers. So, basically the PCP or the primary care provider is giving a update on the telehealth behavior provider or telebehavior health providers who are trying to look at his behavior and understand how he should be counseled, or any kind of depression based medicines have to be offered or whatnot, right. So, this is again a very key opportunity into the healthcare space. So, what are the key entrepreneurial opportunities here? Care management support. So, if this can be provided by some entrepreneurial ventures, could be really helpful for this type of population. Referral to specialist for telehealth visit. This is already there, but if some very specific psychologists or specific doctors can be referred to, then this telehealth visit would be really worthwhile and would be really valuable for this person to not only take care of his day to day operations, but like also understand his depression, right. Next is remote patient monitoring. So, we are also looking at remote patient monitoring. This is a very new aspect. This person has to be monitored on a day to day basis, otherwise it could be that he is in so much of depression, he may self harm himself, or he may go through some kind of a state where he is forgetting his medication, and that has a repercussion. So, these three are the entrepreneurial opportunities which comes out of this kind of a persona, and this persona reflects again a huge group of target customers. So, this is how we try to look at the market from an opportunity standpoint. Another one, unplanned acute kind of condition, where 75 years old has coronary artery disease, it is known as a CAD or CAD, quite oftenly abbreviated as. It is usually a chronic obstructive pulmonary disease, and she also has diabetes. So, this person typically lives with husband who has limited mobility and struggles to secure healthy nutrition. So, this person is not able to move around quite a bit because of the age and the disease conditions, as well as they are struggling with a healthy nutrition, keeping the diet right and also a healthy lifestyle. So, what is the current state of affair? This person is all of a sudden admitted to the hospital with a heart attack and discharged to skilled nursing facility because of concerns about staying safe and engaged at home. So, they are kind of discharged to a skilled nursing facility, discharged as in like they have left the hospital, they are kind of treated for the condition. Now, a nursing facility is supposed to keep them safe and engaged at home, so that she does not encounter such a condition ever again, right. So, this is the important aspect. So, what are some of the future potential states? So, once recovered from the heart attack, she is evaluated by a physician, sent home with an assigned nurse and a care manager. This is very interesting, a very good opportunity where there is a need for personalized nurses, where they are already trained and they can reach out to this kind of people, stay with them 24/7 and basically take care of them, and there is a care manager who keeps on taking updates on a regular basis, right. So, sets up a remote patient monitoring, this is also there. So, there are cases in which the nurses may not be providing the right modality of treatment. So, there is an extra layer of remote patient monitoring, and there could be cases the nurse is not available. In that case also there could be remote patient monitoring. Has daily telehealth visits with physician coupled with in-person care from a nurse. So, there could be cases where the nurse only comes once in a day, does necessary activities which are needed from a day to day basis, gives the right medicines and everything is administered, and this person or the persona which is the Burnett, and she is describing a lot of other population, she is having daily telehealth visits with the doctor she is working with, and the doctor keeps on telling her that your nurse is going to visit, please take these medications and these lifestyle changes, you are doing good or you are not doing that good, you have to change these aspects and whatnot, right. So, the community organization also delivers meals to home, right. This could be an added advantage where this person is not in the position to cook, right. So, specifically in India we would think that cook is very common, but if you are looking at several countries abroad, specifically in the US, manpower is very expensive, and it is not very easy unless you are really wealthy. You cannot afford a cook. So, in that kind of a setting, this is highly valuable. Even in the Indian setting, the prices of hiring a cook is going up and up. So, there may be cases where somebody cannot afford it, right. So, there if some healthy meals can be transferred from the community organization to this particular person, that could be beneficial. So, what are the key opportunities here? Hospital at home program, this could be something which can be monetized on, where basically this person is kind of in a hospital setting where they are visiting, they are being teleconsulted with a doctor on a daily basis and also being visited by a nurse, and they are constantly being monitored, right. So, hospital at home kind of program can be introduced, and this could be really interesting in that aspect. Remote patient monitoring, again that part was already included in the previous persona as well, that remotely if this patient can be monitored, this saves a lot of costs relating to manpower and other aspects, right. While the patient is sleeping, not necessarily a nurse needs to be there all the time, right. So, there is remote patient monitoring is something, this is very new to India, this is not started very widely. So, this is an opportunity which you can bank on. Care management support. So, how is the care properly managed and what is the support given for it? So, let us say the nurse and the doctors are not able to adhere to her condition of some form of depression, they are not specialized in that. Can there be a care management aspect in place in term of an entrepreneurial venture, where not only the right care is given for a disease, but also for peripheral other things such as depression or some other issues which may come up with her mobility is coming up, and it could be easily managed through roping in of other specialists and other people, right. So, social support, this is also something which could be an entrepreneurial aspect. Can a person be getting a social support, and this might seem to be very small, but let us start thinking about where India is heading right now. We all are mostly moving into nuclear families, where eventually our kids will grow up and they are going to either go to their workplace in India or abroad, and lot of these elderly population, including when we will reach that age, are going to be left alone. Like so, having a social community or support is going to be really useful for that person to recover well during her ailment or illness, like chronic illness, right. So, in way of like if somebody comes over at home to talk to them on a daily basis, that could get rid of their depression or provides meals or some kind of extra monitoring aspect which can be provided. So, this is also an entrepreneurial opportunity which is there and currently being untapped. Okay, another persona is, and as I have talked about personas, these are coming from a lot of market research and through surveys where a lot of companies have tried to understand what are the key health issues in the market with respect to telemedicine. Here we are focused at the telemedicine and how that can be solved in form of like knowing the target customer. So, let us look at another target customer. End of life. So, 60 years old, has been undergoing chemotherapy for lung cancer, very unfortunate. So, this person has a kind of a terminal illness where this person may not live for a very long time and has been undergoing chemotherapy. This person is widowed and has a daughter. So, basically they do not have the support of a son, where physical support as in like in the term of strength, where somebody can really run around and sometimes support equivalently. But of course, like her daughter could also support her, because I think there is a very key quality there. So, but in certain cases this could be a particular case where the daughter is also like not working, or she is not able to provide, in very specific case in this persona, where she is not able to provide to that his father or mother for this particular aspect, right, and this is this specific case. So, the current state of affair is not responding to treatment, so elects a comfort care. The oncologist who is taking care of the cancer specialty helps select a nearby hospital facility. So, there is a oncologist on board who is in a nearby hospital, and this person is not responding very well to the treatment. So, he knows definitely he is not going to live for very long, and this is also a kind of persona which is very commonly seen in the Indian and abroad setting. So, some of the future potential states are the oncologist refers a hospital team who can provide care at home. So, this care at home could be of use, like where this person at least has a good experience while at home, he does not get depressed thinking about things are not looking very nice for him going forward. So, there can be a kind of home visit by clinical staff or something like that, which is an opportunity for this market. And the next potential state is the daughter moves in to care for this person. So, in this particular case what I see is daughter is probably married to somebody and she is probably not a earning member and not able to take direct care of his her parents, but like she is ready to move in to take an extra care, right. Like, so these are some potential future state, but this can be disrupted if there is a home visit by a clinical staff with possibility of nurses, right. So, this can be a business opportunity where this set of persona or customers can be taken care of, like using some entrepreneurial aspects. Okay. So, digital health innovations is well known to drive at home healthcare delivery, and this we have realized through some of the user personas we just looked at. So, we can say this is a very consumer centric market where the value pools in Asia are expected to grow pretty widely by 22% per annum through 2025. Up till 2025 it is going to grow pretty rapidly. So, let us look at some of the market sizes. These are some very common terms looked at when you are targeting a new product or a service from an entrepreneurial standpoint. You want to look at how big is the market. Am I jumping into a big market or a very shallow or small market where the opportunities are less and I need to create a new opportunity. So, this is something to look at. So, the first category is wellness and disease prevention, which is majorly the diagnostic category. So, the value pool is improve wellness and prevent disease. So, this is the main value any product or service which you offer as an entrepreneur is going to deliver to the end customers is by improving the wellness and preventing the possible disease. So, what are some of the example technologies which you can build around it are like wearable technologies, activity trackers, fitness trackers. So, you could think of so many brands out there, from Fitbits to Apple Watches to so many other apps and the smart watches which are looking at this activity trackers and fitness on a day-to-day basis. So, this is the space, so this is the product which is catering to this particular space, which is wellness and disease prevention. What is the market size? So, market size in Asia is estimated, so in 2020 it was 2.3 billion, by 2025 it is estimated to be 6.6 billion, by 2020 to 25 it is going to rise at a pretty good rate of 23% CAGR, right. So, whenever you talk about products and services from an entrepreneurial standpoint, CAGR is a term you will see very often. Just to remind to you, this is compounded annual growth rate, right. So, how quickly something is growing, the rate of something is growing. Again, coming back to the next category, which is screening and diagnosis, another type of diagnostic, which basically has the value pool of intercepting diseases through screening. So, you want to make sure that certain diseases do not kick in later at a life and when you realize it is too late, right. So, you want to intercept these diseases and make sure correct treatment modalities are offered. Identify the right patient, right. So, it is not like we start looking at whatever products and services you offer. Let us say there is a product of which measures your blood pressure. So, all of a sudden if the blood pressure starts beeping and saying like you have a very high pressure, so go see the doctor, or there is a device like that, that may not be correct for the right set of population. So, there has to be something like a person in the elderly age group has a different range of blood pressure versus somebody who is an adult versus somebody who is a child, right. So, if these age group blood pressures can be clearly defined, then you can identify the right patient. So, let us say 160 plus systolic, 160 plus is the number after which an adult person would be warned that your blood pressures are going really high, you need to go see the doctor. If you say that for an elderly person, it is a common blood pressure, right. So, identifying the right patient is also important. This is going to add value to the customers. So, value pool basically means what in this particular segment is going to add value to the customers. This is very important to know as an entrepreneur. One example is genomics and omics. This is for intercepting diseases. So, you have an idea probably with recent in way of genomics and other research, where they tried to look at the blood samples and basically come out with what kind of diseases you can possibly suffer with in 10 or 15 years or 20 years. Digital diagnostic using AI imaging, this is very interesting. So, how do you identify the right patient? Through some AI based technologies, which is artificial intelligence. We all talk about AI, but AI is really useful in healthcare. So, what are the key projections here? Market in 2020 was around $3.5 billion. This is specifically the Asian market, which includes several other countries other than India. You have a market size of $11.7 billion in 2025, and you are looking at a CAGR of 28%, very, very high. So, if as an entrepreneur I were to look at this slide, I would know off my head that I would rather, if I can, go for the diagnostic space rather than the other space, which is fitness trackers, right, because 28% pretty high CAGR. Okay. Care delivery, this is another aspect where this digital health is really finds a great opportunity, which is fairly untapped right now. So, care delivery, which the value pool is provides more effective therapies. So, it should not be just a nurse or some kind of a doctor which is who is like speaking with you over telephone or through an app and just telling generic things. Very often than not, you will find a lot of doctors who are not very specialized, they would just not be able to detect your issues. They will just say very generic things, okay, you have some sneezing, coughing, take this particular medicine. You have this issue with your head, like headache, like then go get this medicine. It could be some other underlying disease. So, you need more effective therapies which are provided. You need to provide remote patient support. So, a lot of these patients, once they have teleconsulted or gotten a report from their lab based tests, they are totally clueless what most of the report details mean, and this has happened to many of us. If you just think of it, half of the time we are googling terms in a report. So, can remote patient support be provided where these are explained by somebody who is trained in this and can provide some ease to the end customers, which are the patients like any of you or me, where this can provide an ease to us that yes, I think you are doing good, nothing too much to worry, see your doctor next time after 5 days, right. Supply therapies to patients. Can several therapies to patients be supplied through this care delivery system, where they do not have to visit an hospital, and let us say there are some certain injections like insulin which can be shipped from a local good hospital, and they can take it with a manual which clearly states when that has to be taken and how it has to be administered. So, there are so many aspects and therapies which can be supplied, or there could be a physiotherapy session which can be done at home, through a teleservice, like somebody can do yoga. There could be a teleservice which basically tells you what all things to be eaten and like for a certain disease and whatnot. So, the other aspects are some example technologies for the same are digital therapies, like there are several cognitive games. What are these? This is also a very interesting area. So, several people who have had a traumatic injury and are getting rehabilitated, like let us say they have a foot injury and they are not able to walk properly, there are several games which makes you twist your foot or make your foot like move in a certain way, or your arm if that has got injured, and basically you are trying to get the right rehabilitation through this cognitive games. Sometimes it improves your mental health. So, there are games rooted for that as well. Telemedicine remote monitoring is something which is a great solution. It is very, very untapped. We are looking at some huge markets here. Telemedicine remote monitoring, you are looking at $16.8 billion already existing market at 2020 and looking at $33.8 billion. Quite a meteoric rise like in 20. 2025, which is expected. You are looking at a 37% CAGR. So, if I was in the digital space, healthcare space, I would start looking into the remote telemedicine based health monitoring. This is an aspect where you would find a great opportunity as an entrepreneur to start looking at, right. So, this is what we are going to cover through the entire course, where we are going to look at this very specific opportunities and how we can tap and use them in the right modality, right. So, next is digital pharmacies. This is also very important. So, not everybody wants to go to the doctor and then buy a medicine from a pharmacy. Many a times, like, the right medicine won't be available. That happens to me quite personally when I visit the doctor for my kids medicines, like who is a 2-year-old, like I am not able to get the right medicine or the right brand every time. So, if there are digital pharmacies which can give me the right brand and right medicine in no time, this is the key word, in almost no time, then digital pharmacies can really do well. So, if you are trying to get into this space, speed is of course the keyword here, and another keyword is basically sufficing with all the possible brands which are well known in the market. So, several times people are attached to certain medicine brands. They want to go with, let us say, Sun Pharma, or there is a particular medicine brand which they want to associate with. So, if you are looking from one brand to another, they may not want to switch because the medicine name has changed, right. Okay, switching gears, very interesting aspect which we have lot seen coming together is digital wearable device. Plethora of this devices we are looking at, which can basically be summarized as a lab on skin. We basically as if have a lab or a laboratory on our entire skin. This can go from glasses to headset to the different sensor based clothings, the digital watch which we are wearing. It can have sensors for measuring our blood pressure, glucose monitoring, heart rates, sleep cycles. There are digital strips, there are digital rings which are also worn, there are shoes with particular insoles which are measuring your body pressures, like the foot pressures and detecting diabetes. There are certain belts to look at the obesity. There are so many aspects which all comes under these wearable categories, which are also in a huge influx in the Indian society right now. Watches, we have already seen there has been a drastic shift from the Fitbit and the Apple Watch. Nowadays, you find a watch for 800 rupees, 1000 rupees, 5000 rupees, whatever you want, you will find that watch which is a fitness watch or a digital watch, smart watch. So, I encourage you all to kind of look for these kind of watches in the in a particular watch store, and you will see it covers the entire range of things what an Apple Watch and other watch companies are offering. So, basically what that means is there is competition, number one, and second is this space is extremely cluttered. So, if I was an entrepreneur who want to get into a certain space with a digital or a smart watch, I would probably refrain from doing that unless I have a very new sensor or a new capability which has to be offered, right. So, having said that, I could easily venture into the other spaces which are less cluttered. Let us go further. Another set of basically products include the implantable, ingestible and injectable. These are three different categories. Electronic revolution. So, we have come across the revolution where there are so many different sensors which are built on a day to day basis. Most of the healthcare innovation is done usually at a startup company level or institute level. Lot of the IITs and NITs are already working with it and are not leaving the private institutes, and a lot other government institutes at the state and central level are doing the same. And also these kind of innovations are sometimes done a little bit at the college level, where these could be later on bachelor's thesis or something like that. So, a lot of these technologies are coming out, and several of these technologies are imported and taken in India and are made at a much more lower cost. So, this is what the revolution is going on. This includes certain implantable devices, which basically refers to a medical device that have specific functions beyond passive monitoring for fixation. So, this can have specific functions, like it could be absorbable, like after a certain point, let us say here is an example where there is a fused bone with a sensor placed in between, and this fused bone, once the bone growth is proper, this automatically gets absorbed to the system, and then there is nothing more. Everything is seamless, you do not need to cut a incision and bring this sensor out. So, it is self absorbable. So, it is solving that function. These are all multifunctional, and also throwing in a lot of data on how that particular wound or injury is healing after having the right modality of medication, right modality of the implant. So, how things are healing, so that kind of tracking is quite possible. Key technologies which will drive these kind of innovations: printable and fixable electronics. So, there are so many printable, sometimes 3D printable, sometimes sophisticated printings, and flexible electronics which are taking this space. Functional 3D printing is another aspect. Wireless energy transfer and harvesting. So, several we have worked on a recent technology where there was a energy harvesting insole. Insole is something which is inside your shoe. If you just look inside your shoe, that is the insole. So, we were trying to harvest energy through basically the walking. So, while you are walking or running around, there are piezo electric sensors which convert the movement of your body or the walking steps into energy, and that energy is being used further for driving several implants or flexible electronics or hearing aids or small smartwatches and charging those, right. So, this is another space which has huge potential. So, we are going to close the session here and pick it up from here in the next session. Okay. So, thank you all.